Hello, my name is Gabriel Zavala. I study nursing at the Catholic University. My topic is Clamydia Complication. Definition. Chlamydia trachomatis infection is a common sexually transmitted infection. You may not know you have chlamydia because many people have not seen or symptoms. Chlamydia trachomatis mainly affects young women, but it can occur in both men and women and in all age groups.
Chlamydia is a sexually transmitted infection caused by the bacterium Clamydia trachomatis. It is the most common bacterial STI, mainly affects young people 15 to 24 years of age, and is more common among women. Between 1997 and 2011, the number of infected people nearly tripled. The people most at risk of chlamydia are those who have multiple sex partners, those who practice unsafe sex, and those who have a history of other STIs. In men, symptoms can include a discharge from the penis, pain while urinating, along with tender or swollen testicles. The symptoms resemble those of gonorrhea. They can appear intermittently or disappear completely while the person remains infected. In women, symptoms include an abnormal vaginal discharge, bleeding between menstrual periods, or after sexual intercourse. In both men and women, chlamydia can cause rectal itching or bleeding, as well as anal discharge and diarrhea. However, chlamydial infections are asymptomatic most of the time. To diagnose chlamydia, a test is required. For women, screening involves a cervical exam with a swab sample. A urine test can also suffice. For men, a urine test is now equally effective and less painful than the traditional urethral swab. Chlamydia is easily treated with antibiotics. You need to take the full course of medication and refrain from sexual relations, oral sex included, until the treatment is complete. After symptoms disappear, the infection can linger in the body and still be contagious. To break the chain of infection and to avoid being reinfected, you need to alert all your sexual partners within the previous 60 days and encourage them to get screened and treated if necessary. Your doctor can assist you in using our anonymous partner notification service. Some effective ways to prevent chlamydia are practicing safe sex by always using condom, avoiding sexual relations under the influence of drugs or alcohol, and limiting your numbers of sexual partners. You also need to get screened regularly for STIs. Your sexual health is important to us and to you, so have fun, but be safe.
Application in nursing, patient health education, administration of antihistamine and analgesic, control of constant and body temperature, monitoring and controlling the characteristics of urethral secretion.
Now, if we look at the development of a cycle of chlamydia, we are going to see the pathogenesis in much more detail. Now, here comes the first step. So, let's say this is the large cell is the eukaryotic cell which is to be attacked by chlamydia. Now, here comes the elementary body. Remember, elementary body will come, which is acting like viruses, cannot divide outside the cell, so they will come and attach to the host cell. After the attachment, they will guide the host cell to engulf them inside by the invagination or endocytosis pathway. After this endocytosis is done, this chlamydia or elementary body is now inside the vesicle. They will start to thrive and start growing and dividing inside this vesicle. Sometimes they can also come out of this vesicle to the cytoplasm and then start growing and dividing several times. Now, as they are growing and dividing several times, as you can see here, right? So what we can see here, once after they are internalized, the recognition and they are converted into reticulate body. So once, which was elementary body, after the engulfment, staying there for few while, they will be converted to reticulate body. So their structure will be increased, as well as they get the ability to grow and divide rapidly. So once they get this ability, they will grow via the binary fission process for 24 hours. Now for further this 24 hours, what we get more and more reticulate bodies and small elementary bodies. Now as we are getting more reticulate bodies here, those reticulate bodies will be now converted into elementary bodies, because if they want to release something outside, that should be elementary bodies, because reticulate bodies cannot survive outside the host cell, right? So now when they recognize it, it convert to the elementary bodies. Now inclusion contains both of them, elementary body as well as reticulate bodies inside them. Now what they will do, now they continue to reorganization, and after certain time, when they get the environment is ready to release all these materials, they will open this vesicle and it will release all those reticulate bodies outside. So now what we get, many more reticulate bodies coming out, and these reticulate bodies are ready to again attack another healthy host cell, and the cycle will continue like that.
Pros and cons. Chlamydia trachomatis bacteria are most often transmitted through vaginal, oral, and anal sex. It is also possible for a pregnant woman to pass chlamydia to her chest during delivery, causing pneumonia or serious AIDS infection in the newborn. Complication chlamydia trachomatis may be associated with pelvic inflammatory disease, infection near testicles, infection of the prostate gland, infection in newborn, ectopic pregnancy, infertility, reactive arthritis.
What is it, and how does it spread?
Well, chlamydia is, as we explained earlier, is also sexually transmitted diseases. Is caused by Clamydia trachomatis, and it's so common and so persistent because it's a silent disease. You could have it forever and don't know you have it. And the most likely is sometimes you get a clear discharge, vaginal discharge, but that it's so common for women to have discharges that they don't even notice that they have this. So nowadays the recommendation is that anyone gets, before the age 24, gets a screen for a chlamydia infection. And it's very simple to be screened for a chlamydia infection. You could do it in urine, you could do it to a cervical swab. Why is this so important? Because the chlamydia is something that you pass from one partner to the next, especially in people who have multiple sexual partners. And chlamydia, even though it does not cause any particular severe infection, it causes a lot of issues with infertility later on in life. It affects the fallopian tubes and could predispose to ectopic pregnancy and other complications that are associated with it.
Yeah, I wanted to get to that too because you mentioned infertility, but there's a number of complications here with chlamydia. I don't think people would immediately think about it.
Right, exactly. Especially because it's such a silent disease. It's going to cause pelvic inflammatory diseases and inflammation of the pelvic cavity. Infertility because it affects the fallopian tubes. The fallopian tube have a cilia, which is what allows the motility of that sperm to travel and the egg to travel and meet the sperm. And when that cilia gets affected somehow, it predisposes to ectopic pregnancy. What happens with ectopic pregnancy? Well, ectopic pregnancies are those pregnancies that occur outside the uterus that could rupture, and it's an increased risk of maternal mortality. As well as pregnancy complications, chlamydia infection could predispose to preterm labors, and newborn complications. Well, babies are born, they use antibiotic on the eyes, and the reason is to prevent chlamydia infections.
Can chlamydia, I guess, we're always talking about cures. Is this something that can be cured?
Yes, chlamydia is cured, as opposed to any type of other things that we discussed, herpes or HIV. Chlamydia is easily cured with an antibiotic. Citromax covers quite easy. Now it's important that not only you get treated, but your partner gets treated, because otherwise the infection comes back.
Issue athlete in Ecuador. 99 patients in a hospital in Ecuador were studied, majority between 16 and 17 years of age, single and has had only one sexual partner in the last year, 86 cervical samples were analyzed, of which almost half, 41.8%, were positive for C-trachomatids. Conclusion. The knowledge deficits against risk sexual behaviors in the young population chlamydia infection favor an increase in the prevalence. Therefore, it is of utmost importance to perform new study in order to provide data to promote health programs aimed at raising awareness of young people against this infection in order to reduce the incidence of this disease and its complications.
So chlamydia is a very common sexually transmitted infection that we see. It is a bacterial infection, which means it's unlike some of the other viral infections that can live in your system long term. It can be treated because it's bacterial, so it can be treated with antibiotics. The most important thing about a chlamydia infection is that it is necessary to treat it early and completely to avoid the long-term consequences of having an undiagnosed bacterial infection in the genital tract. One of the most worrisome things that we see in relation to chronic chlamydial infection is infertility that's related to scarring, long-term chronic infection of the genital tract. Chlamydia is an infection that we see often in patients who have absolutely no symptoms. It's more common in men to actually be symptomatic. So in a man with a chlamydia infection, they will often have a purulent penile discharge and potentially painful urination. The same is not true for women, and it's not uncommon to see a chlamydia infection picked up on a routine exam at the time of a routine health physical.
Thank you for watching the video. Bye.